Where's the University of New Brunswick? It's anywhere our students are immersed in their fields. It's wherever they're using hands-on learning to solve real-world problems. It's where we help you find your future.
Good afternoon, everybody, and thank you for joining us today. My name is Paul Mazerow, President and Vice Chancellor at the University of Brunswick, and I'm most pleased to welcome you all to our next Shaping the Debate event, the first that is open for public engagement and dialogue. I'd like to extend a special welcome and thanks to the Honourable Dorothy Shepherd, Minister of Health for New Brunswick, who will shortly lead off our discussion. Before we get started, I'd like to take a moment to respectfully acknowledge that UNB stands on the unsurrendered and unceded traditional Wolastoqey land. The lands of Wabanaki people were recognized in a series of peace and friendship treaties to establish an ongoing relationship of peace, friendship, and mutual respect between equal nations. The river that runs through our province is known as Wolastoq, along which live the Wolastoqey, the people of the beautiful and bountiful river. Wolastoq is also called the St. John River. Again, welcome to UNB Shaping the Debate public dialogue series. The topic for today is a sustainable future for healthcare in New Brunswick. This is a topic that is incredibly important to all of us here today. Nearly 600 people have registered for this virtual conversation, clearly demonstrating the importance of this complex public policy issue. And I'm pleased to see so many people joining us from across New Brunswick, as well as from across Canada and beyond. As New Brunswick's national comprehensive post-secondary institution, UNB strives to serve the public good. UNB spurs economic growth, enables social development, and fosters sustainability by collaborating with government, industry, and community to turn ideas into action. In short, we strive to be the university for New Brunswick as we strive to build a better future for all. As a trusted voice in major discussions and debates across our communities, the Shaping the Debate series is one way we at UNB can accomplish our mission to operate as a vehicle for social change and social progress. We believe that the essential conversations need to be had to support the productive and prosperous future we envision for our province. We recognize that the solutions we identify and the strategies and policy and programmatic responses developed will work best if we work in partnership. It is rare these days that a large social challenge can be simply addressed. Most issues and challenges are complex and they transcend portfolios. To be effective, we need to develop and implement solutions in partnership with others. Partnerships are the key, in my view, to confront and address many of the challenges that we see across our communities. We know that New Brunswick, not unlike other jurisdictions across Canada, and indeed around the world, face significant challenges that affect quality of life and overall community well-being. These challenges are many and varied and impactful to the individuals and families. Foremost among them are the importance of public health and healthcare reform. Indeed, ensuring a sustainable and future-ready healthcare system will weigh heavily on the socioeconomic success of New Brunswick and New Brunswickers. Indeed, this is an area that affects many families at the local level. We recognize that many of the other challenges we face, including economic disadvantage, education, homelessness, drug and alcohol abuse, and various other social issues, are also impacted by our healthcare system. We all have a stake in the success and sustainability of our healthcare system, and we all have an opportunity to contribute to the development of innovative solutions. UNB is deeply committed to doing our part. Our discussion today will begin with the New Brunswick Minister of Health, the Honourable Dorothy Shepherd, who will speak to us regarding the importance of achieving sustainable healthcare in New Brunswick. We will then turn to some of the researchers who are developing meaningful, evidence-informed approaches to improve health outcomes for New Brunswickers. And finally, we will respond to some of the close to 100 questions that were submitted in advance of this conversation and give you in attendance today a chance to pose additional questions. Finding solutions depends on the nexus of good ideas, clear commitment to be solution-focused, and the holding of meaningful exchanges and dialogue. We believe that the Shaping the Debate platform will enable the critical exchange of views and contribute to the provincial healthcare reform process. It is intended to be a mechanism to share ideas and perspectives in an honest and respectful manner. UNB Canada is willing to play a central role convening events to share ideas and catalyze actions to help build a more prosperous and just future for our communities. Thank you again for attending today's event. And I'll now turn over the program to Matt DeCourcy, our Senior Advisor in Strategic Engagement, to introduce Minister Shepherd and moderate our discussion on a sustainable future for healthcare in New Brunswick. Thank you very much.
Well, thank you, Dr. Masral. Et merci à tous qui sont avec nous aujourd'hui. Thank you, Waliwan, to all of our participants and attendees who are with us for this public dialogue that's taking place via Zoom webinar. And that means for those of you tuning in, you will not be able to be seen nor heard by our speakers, but it doesn't mean you can't be engaged in the conversation. We're going to encourage you to send notes to the chat to our speakers and certainly to our back-end team. If you need any technical support, they're there to help you make sure you can see and hear and be a part of this activity. We also are asking that you submit any questions that you have to our speakers through the Q&A function, which is at the bottom of the Zoom screen. Also, as Dr. Masral mentioned, we've gone through already the almost 100 questions that were submitted during the registration phase for this activity. Many of those questions are going to be answered by today's speakers and panelists throughout the session. And then we'll do our best at the end in the Q&A section to put them into themes and pose them to our speakers to make sure that our attendees are heard. I also want to say hi to our friends in the media who are joining us today. And I'm going to ask you to please identify yourself in any of your interactions with the chat function or any questions you may pose. And I'll also ask you to email talktous@unb if you have any outreach that you want to make to any of our researchers or speakers today. One of our communications team members will certainly be sure to be in touch with you, and thank you for joining us. I also want to remind everybody who's attending today that comprehensive, exhaustive biographies of all of our speakers can be found on UNB's Shaping the Debate webpage, and they are quite complete. These are accomplished individuals we have here today. Finally, today's session is being recorded so that we can share it with you afterwards, and so it will exist on UNB's website. And with that, I'd like to get started by introducing our first speaker, and that is the Minister of Health for New Brunswick, the Honorable Dorothy Shepherd. First elected to the legislature in 2010, she has served as the MLA for St. John Harbour ever since. In 2012, she was sworn in as the Minister of Healthy and Inclusive Communities, and after re-election in 2014, served as opposition critic for Human Resources and Women's Equality, and then as critic for Families and Children. In 2018, she was sworn in as New Brunswick's Minister for Social Development and the Minister responsible for the Economic and Social Inclusion Corporation. And finally, on September 29th, 2020, she was sworn in as the Minister of Health. She was born and raised in St. John. She's a longtime community volunteer and business owner. And the minister and her husband, Art, have been married for 4 years and continue to live in St. John's Lower West Side. Minister, thank you so much for joining us this afternoon. I'll disappear and the screen is yours.
Thank you so much, Matt. Good afternoon. Bonjour, Walilan. It's a pleasure to share this time with you today, and I want to thank UNB for organizing this event. This type of engagement from the larger community is exactly what's needed as we work together to build a sustainable public health system. Today, I've been invited to give you an update on the development of the new 5-year provincial plan. Put simply, the Provincial Health Plan is a document that lays out the priorities for the healthcare system and guides regional health authorities as they plan for and provide healthcare services to New Brunswickers. When we began talking about the development of the Provincial Health Plan, we knew it would be important that New Brunswickers understand the challenges that we are facing. That's why, in advance of the public engagement process, we released Striving for Dependable Public Healthcare, a discussion paper on the future of healthcare in New Brunswick, which outlines these challenges. We know the demands being placed on the healthcare system, and those who work in it are extraordinary. Approximately 30% of our hospital beds are occupied by seniors requiring care that could be provided better outside of the hospital walls. Our emergency rooms are full of individuals who would be better served by their primary healthcare provider or who can't be admitted because there's no space for them. 90% of us have a family physician, but only 55% can get an appointment with our physician within 5 business days. In addition, our population is aging. By 2026, 26% of our population will be over the age of 65, and our need for healthcare services increases exponentially as we age. Our workforce is also aging. The system is struggling with shortages of nurses, doctors, public sector psychologists, and other professionals. In addition to addressing the challenges the system is facing, the discussion paper also lays out a vision for dependable public health care, a system that optimizes public population health and well-being, provides quality patient-centered care, starting with access, improves addiction and mental health outcomes, improves the care and service experience of our seniors, provides innovative care using digital technologies, and maintains and invests in facilities, technology, and equipment. My goal is to have a health system where patients and providers are equally satisfied. I think that would be a most potent recruitment tool. There's a lot of work to do if we are to achieve this vision, but I think it is achievable if we work together. To start, I wanted to gather as much input as possible from the public and from the people working in the system. COVID-19 certainly didn't make that easy. I would have much preferred to travel to communities and talk about healthcare with folks over coffee. But COVID-19 does not allow for that, so in the end, we had a virtual tour via Zoom, just like today. In total, we held 49 meetings and talked to nearly 2,000 New Brunswickers of all ages. We visited 15 communities in total, but that's not all. As part of the process, I talked to doctors, nurses, nurse practitioners, and allied health professionals. Many of them told me it was the first time a minister of health had consulted them directly on the development of the health plan. I also talked to First Nations chiefs and health leaders, women, members of the 2SL LGBTQIA+ community, healthcare unions, stakeholder groups, linguistic groups, regulators, and post-secondary institutions. We've also received more than 500 email submissions and counting. Every single idea we receive from New Brunswickers will be considered as part of the provincial health plan. Through the public sessions, we've learned a lot about the gaps in the system and what's important to residents. People were incredibly candid in sharing their experiences with the health system, as well as their ideas about how it could be improved. It's impossible to share all the ideas we've heard in the short time we have today, but I will give you a few examples of the themes that began to emerge as we worked our way through the sessions. The first one is prevention. We know that health starts at home. It starts with a healthy, safe environment, healthy food to eat, the opportunity to move your body, the knowledge to make good decisions about the habits that are healthy and the ones that are not. The most beneficial healthcare intervention is the one that we never have to truly make. Prevention is the key to health, and New Brunswickers said that loudly and clearly during our sessions. New Brunswickers also made it clear that when they need to see a healthcare provider, they expect one to be available in a timely manner. I said earlier that 90% of us have a family doctor, and that doesn't sound so bad, right? But if you're in that 10%, it means you have no choice but to go to the emergency department or to use a walk-in clinic to get the most basic of healthcare service. To me, 9% is not good enough. Every New Brunswicker deserves to have a primary healthcare provider who they can get an appointment with in a reasonable amount of time. The introduction of virtual visits during the pandemic have been a welcomed addition and has increased access to care. But we need to make sure that the care provided virtually is appropriate and that the patient outcomes are measured. Doing a better job of recruiting and retaining healthcare professionals will certainly go a long way to addressing some of our primary healthcare access challenges. I committed during the budget process to moving recruitment under the Department of Health, and we are currently exploring it. I firmly believe that recruitment needs to be centrally coordinated and then carried out in partnership with the RHAs, clinicians, and communities. It doesn't mean we're not going to utilize the expertise of our RHA partners and, and the MBMS and nursing professionals and their associations. But what I do feel we're lacking is a full-blown strategy that is led. And so my intention is that the Department of Health will lead it. I also believe that recruiting health professionals needs to start early, when students are thinking about their future careers. Students need to be made aware of careers in healthcare right there in their community. But it's not just the job of the provincial government or the regional health authorities to recruit. I fully believe that municipalities and communities have a big role to play in making their areas attractive to prospective providers. That will look different in each community, but every area needs to start thinking about what they can contribute to the recruitment process. Another thing that we've heard consistently was it doesn't matter how many excellent services are available. If the patient doesn't have the means to get to that specialist appointment or test or procedure, it doesn't matter then. During the consultation, we heard from patients who simply did not have the means to travel to their medical appointments. We heard from doctors who gave money out of their own pocket to patients so that they could put gas in their car to get to appointments. Transportation was absolutely one of the highest rated topics through our whole engagement process. Transportation in a rural province such as ours is a huge barrier to healthcare services and other services as well, and I'm committed to exploring what we can do to make transportation less of a challenge. And you know, when we look at the social determinants of health, transportation could be a barrier to many things. It can be a barrier to getting healthcare services or healthcare treatment. It can be a barrier to post-secondary education. It can be a barrier to employment. So transportation needs to have a big conversation in this province. And transportation is just one aspect of rural healthcare that needs to be addressed. Time and time again during the engagement process, rural New Brunswickers expressed the importance of access to quality care services. We also heard from New Brunswickers that the healthcare system can be a confusing place to be. Whether it's navigation of the programs and services available or moving between facilities that don't seem to do a good job communicating with each other, we know that improvements are necessary to provide the best experience possible to patients. We also heard from francophones who made it clear that they can't rely on getting healthcare services in their language of choice outside of Vitalité. In a bilingual healthcare system, it's imperative that New Brunswickers can access services in their language of choice. Another topic we heard consistently about was mental health and addictions. About a month into the engagement process, the department released its new 5-year Addictions and Mental Health Action Plan. The new plan aims to address the increasing demand for addictions and mental health services. We heard from New Brunswickers that the need for these services is greater than ever, as they spoke about recent tragedies in our province and the need to do better. The recent budget included further investment in mental health programs. And I also think one of the best things that we can think about is the fact that mental health and many components of our healthcare delivery services needs to be government-wide. We can't do this in isolation without partnering with Department of Social Development, Department of Education, Justice and Public Safety. There are so many components to the well-streamed delivery of healthcare services. It cannot be done without input from all of these departments. We know that good health starts with good mental health, and the provincial health plan will include further action in this regard. Other topics that were consistently mentioned during the process related to better access to primary care for seniors, with the need to keep seniors at home longer and better organize our long-term care sector. Women, with requests for more midwives, access to fertility treatments and gynecological care. and the 2SL LGBTQIA+ community with improved access to primary health care and with fewer barriers to affirming healthcare services. One thing that became abundantly clear to me as I sat in front of my laptop night after night, listening to New Brunswickers talk about healthcare, is this. New Brunswickers care about their healthcare and they want to be engaged. They want to be included. They want to see themselves reflected in the decisions that are made. And I think they deserve that. The conversation that we've begun about healthcare is a conversation that's long overdue. New Brunswickers should expect their elected leaders to address the challenges our healthcare system is facing. We are currently living the reality that comes from not taking action. A system that doesn't meet the needs of patients and is a frustrating place to work for health professionals. We need to improve so that we can provide the quality care New Brunswickers deserve. Our government wants to work with New Brunswickers to build a safe, sustainable healthcare system that is responsive to the needs of patients and communities now and into the future. We know that change is needed in our healthcare system because right now it isn't sustainable as it is. In the past, when governments have tried to make changes, communities have not felt like they were a part of the solution. Regardless of the intent, the impact is the same. There is a lot of distrust and fear around the healthcare system. In the absence of the change that is absolutely necessary to ensure its survival, the system is suffering from paralysis. The future of the healthcare system depends on the decisions we make right now. The provincial healthcare plan will be the foundation for the future of healthcare in our province, and I believe that future is bright. Every community and healthcare facility has a role to play in our healthcare system as we look to build a network of excellence that prioritizes patient care, safety, and efficiency. And almost every governmental department has a part to play as well, just as I mentioned earlier. Addressing healthcare challenges must not happen in silos. I've said it before and it bears repeating that if departments are not willing to leave those silos and break those walls down, I will take a sledgehammer to them. Transportation and infrastructure, post-secondary education, training and labor, justice, public safety, social development, education, and early childhood education and early childhood development must all come to the table, and we must all work together. And I'm very fortunate. Luckily, my colleagues in government feel the same, and we are ready. I don't care much about political legacies. But the utmost goal for my time as New Brunswick's Minister of Health is to leave a sustainable provincial healthcare system that responds to the individual needs of the individual communities it serves. We will put patients at the center, and we will have a plan to deliver clinical services so they are responsive to the needs of the people living in this province. We will ensure that every New Brunswicker has access to the healthcare they need to be physically and mentally well. We will ensure that these services are provided in the patient's language of choice, and we will have healthcare institutions that are physically and culturally safe. We will rebuild our system on partnership and support it through research and innovation, and we will do this together. I have committed to New Brunswickers, citizens, and providers alike that the conversation that we have started will continue. I have no intention of giving the provincial health plan to the regional health authorities and checking that box and moving on. There will be continuous engagement and we will measure our progress. We have a real opportunity before us. We have the opportunity to build something that we can be proud of. We can be an example in excellence in healthcare. But to do it, we need to be committed to working together and to finding new ways. Thank you for sharing this time with me today. If you have any ideas about how we can improve healthcare, please send them along to healthplansante@unb.ca by May 15th. Every idea will be considered as we build a provincial health plan we can all be proud of. Thank you. Merci. Thank you.
Thank you so much, Minister, for being here once again and for setting the scene for us today, sharing the interactions and the things that you've heard from New Brunswickers and how that dovetails with your vision for dependability and sustainability for the long term of our healthcare system. And thank you for that call to action, which is for New Brunswickers to take part by giving feedback on the health reform process. We will flash that email up at the end of today's session and share that with all participants so they can take part in this endeavor. And we'll have an opportunity to dig in a little more on some of the issues that you outline further in today's program. But up next is our very own Dr. Petra Hauff, UNB's Vice President, St. John. Since joining UNB in this role in March 2019, Dr. Hauff has shown herself to be a dynamic leader, and she's actively engaged in all aspects of campus affairs, from academics to administration and to operations. She's an internationally renowned researcher who every day is building UNB's momentum as a global leader in research and innovation. And in the St. John community, she's stewarding UNB's Integrative Health Initiative, which you'll hear about shortly, and is building strong cross mutual partnerships of benefit with organizations such as Living St. John, Envision St. John, our partners at Opportunities New Brunswick and the Atlantica Center for Energy. Dr. Hauff, over to you.
Thank you, Matt. And thank you for having me. When we talk about sustainable and future-ready healthcare, for me, that means talking about innovation, entrepreneurship, and collaboration. And systemic transformation for me is evidence-informed and people-centered. And I want to show a little bit about our Integrated Health Initiative and talk with you about how this part of the Integrated Health Initiative is actually delivering on those topics. So we have developed 5 major pillars. It's an ambitious program that is connecting different areas. So the first part as a university, of course, is around health education. And I stress interdisciplinary health education by breaking down the walls that Minister Shepherd was just talking about. We will educate out-of-the-box thinkers. This is about the next generation of problem solvers, driving innovation, fostering integration, and leading collaboratively as a team in difficult times. And we have already started developing new innovative academic programs, like the Bachelor of Health program, which had, despite COVID, the first intake in person on the St. John campus last September. We are developing a master's in public health and health policy. And our well-known MBA program, Uptown here in St. John, will add a specialization in management in health. And again, all these academic programs are tailored to help to address the issues we are seeing in our health systems. And it's really important to incorporate everywhere experiential education in those program offerings to provide students with the hands-on experience, but also to expose them to the different facets of health and our health sector. The next part, of course, is research. UNB is a comprehensive university, and we want to address and focus our integrated and collaborative health with clustering world-class researchers who focus on those integrated health research, again, driving cutting-edge discoveries, technology and systems, but also on policies. If we want to drive change, it is important that we are setting up our technology, our systems and policy accordingly. And we will develop those health research clusters of regional and national importance, improving the services for every citizen. This is always our focus. We have identified 5 research areas, and you will see that they are actually complementing the experience and the expertise that already exists. Digital health, there is no future in health without digital health. Child rights and child health. We have to focus on our children health, and public health and health policy, but also management in health and aging in the community, a very important part for us. And when you look at the history of UNB, there's always one part that comes through all the research activities, and this is technical and social innovation. So we want to provide those explorers, how I like to call them, and innovators, the space to drive forward new integrated approaches in health and social innovation. It's about the people, the health and the well-being of our people. We want to create a hub where public and private partnerships engage in entrepreneurial students, researchers, to spin off those new businesses, products, and services that we need. And we will succeed in this marketplace because we are putting a special emphasis on social innovation. We want to strengthening civil society and improving mental health, which is so important. There is no health without mental health. We want to prioritize those social science research and community engagement to reduce social conditions that are impacting the health of our people, like poverty, illiteracy, and substance dependency. And together we will find effective ways to address health outcomes and health services. And with this also increase economic productivity. And that leads me automatically to our fourth pillar. When we talk about researchers, they're experts in their discipline, in their fields. They gain new knowledge, they develop new knowledge, they do new discoveries. And very often the first step is to share this very important new knowledge within their disciplines with other experts in the field. We want to add to this by transferring this knowledge in a language that is accessible for everyone, also the non-experts. For example, we have recently developed together with New Brunswick Community College Allied Health here on the St. John campus, a workshop for everyone who is interested in the process of aging. Everyone who is confronted with aging, whether aging themselves or caring about people who are aging, without having to be experts to better understand that process. The other part is commercialization. If we have programming, innovation hubs where we create this new knowledge and develop these new things, we don't want these ideas to just sit on a shelf and collect dust. We want to create this vibrant ecosystem where those innovators and entrepreneurs work together with our scientists, with the clinicians, with the healthcare providers, and all look from it from a variety of technologies and research fields. And we are doing this together with the LA group from Surrey, BC, and Opportunities New Brunswick, with building the Health and Technology District St. John here on the UNB St. John campus. And I know you will hear a little bit more about this in a minute. So we want to build this continuum from educating our undergrad students to our graduate programs within the UNB Innovation Hub to practical applications and commercialization of new approaches and innovations. And in order to make this vision to come true, we need a purpose-built facility. And this leads me to the last of our 5 pillars, the Health and Social Innovation Center. This dynamic center for education, research, and innovation creates this space to make all this happen, to attract the students, to attract these world-class researchers with top-notch research space, which is open, transparent, and fosters this collision spaces and innovation hub to get the people together to share their ideas, whether they are undergrad students listening to a talk or graduate students doing their research. We want to ignite this innovation, reflection, and community engagement and entrepreneurship. And as importantly, we have to foster collaboration with our partner institutions, again with the community, but also with private sector and industry. And so we provide these experiential education opportunities for students through the Innovation Hub. And these are my 5 pillars, but it's important for you to learn that those 5 pillars, the Integrated Health Initiative, actually have significant outcomes. We will create together a National Center of Excellence in Health. We've developed sustainable healthcare for families with efficient and high quality service. We are ensuring better use of the provincial healthcare funding by supporting the research and providing the evidence that is informing policies moving forward. We're contributing to reform and innovation, resilience, and transformative change. And we're growing population by attracting not only high qualified personnel, but also students to our region and to our province. And it's really important that we are empowering existing networks. We don't have to build everything from scratch. There's a lot of expertise and knowledge already here in the province. We have to get this together, build on it, and create these new innovation ecosystems. And with all this, we're actually contributing significantly to the government's key priorities, like dependable healthcare, world-class education, energized private sector, and vibrant and sustainable communities. And this leading reputation will also put us forward on the economic growth. So if we're looking at the Integrated Health Initiative, we anticipate over the next 8 years that the enrollment on the St. John campus will grow by 500 additional students. This is a 25% increase in students, and those students will not only come from New Brunswick, they will also come from other provinces in Canada and the world. With all those research clusters, with these new faculty members, with the staff, the lab technicians, the lab managers, all this together, we're anticipating a growth of 40 million in payroll. This is money earned here in the region and spent here in the region. We are attracting additional research funding by putting our efforts together in those research clusters, which can anticipate an additional 4.5 million a year through this research funding coming to UNB. And again, this is funding that comes from outside to the province, into the province, and is spent here. So to finalize my presentation, it's about mentioning again how significant the impact is of reputation as a leader in health innovation. We will strengthen UNB's 2 campuses to create this globally significant location for health research and innovation, which will lead people to come here to look for our advice and to gain from and benefit from what we experience here and what we develop here. We're going to create this hub where public and private partners engage with the students and the researchers to create these new products, businesses, and services. UNB will utilize St. John as a living laboratory. We're producing the data that empowers the provincial government to engage in this evidence-informed policy reform in health and social services, because it's not only about the healthcare system change. Now it's also, as Minister Shepherd mentioned, moving forward and re-evaluating on an ongoing basis how the change is implemented, but also how the change holds up with the changes that are brought to us. We are educating these forward-thinking professional healthcare administrators who work in a variety of settings, have a better understanding of health in a broader way, and will create this awareness of the various dimensions of wellness. And with this, I thank you for your attention.
Well, we thank you, Petra, for that wonderful overview of the Integrated Health Initiative and UNB's central role in bringing together education, research, innovation, the knowledge transfer and commercialization, and the importance of the necessary infrastructure to house it all as a way to really be a game changer in the way the healthcare system operates and its future readiness for New Brunswickers. And I know our researchers at UNB, who we will get to shortly, have lots of other programs, projects, and initiatives that help feed into this whole vision of a health innovation hub housed out of St. John, but really beneficial to the entire province. So thank you for today's intervention.
Thank you.
Our third speaker, and you mentioned, is a partner of UNB's. She is the Vice President, Healthcare and Innovations with the LARC Group, Ms. Rowena Rosati. Ms. Rosati is a highly successful healthcare leader with more than 35 years experience as an executive across multi-site, complex health and business environments. And she currently serves as Vice President of Healthcare and Innovations for 2 private health sector companies. She's also an advisory member of the Conference Board of Canada, the Council for Innovation and Commercialization, and the Center for Business Innovation. And she's a mentor at Simon Fraser University's BD School of Business, as well, in addition to the wide acclaim as a senior leader in these fields. She's a clinically trained nurse and paramedic. Rowena, we are so pleased at UNB to be building a long-term partnership with the LARC Group, and we're eager for you to share with today's viewers just what that can mean for New Brunswick. Alors, c'est à vous.
Hello, bonjour. Thank you so much. It's such a pleasure to be here. Welcome to everyone from British Columbia. You saw the introduction. I want to introduce myself. I am a nurse. I am a clinician, 35 years in many, many clinical environments, rural and urban, and really found myself becoming somewhat frustrated over the years that our frontline clinicians were becoming exhausted, and our citizens were not necessarily getting access to some of the most advanced care, and the cost of care delivery was starting to impact accessibility. So we embarked on what it was a large project in Surrey. That was the last role that I had around how do we expedite and accelerate ways to bring healthcare solutions to the people that it needs to reach. And we started an initiative known as the Health and Technology District. Perhaps we can show a couple of our slides that will introduce our Health and Technology District. I want to tell you a little bit about that, and then talk about how this is now developed into a partnership, which we believe is going to enhance not only health and services in New Brunswick, but across Canada. So I'll open it up to a short video just to give you a little bit of the background around what we have created in British Columbia, and then we'll talk about the impacts that this will have here in St. John.
The Health and Technology District is an innovative ecosystem of the world's brightest inventors and entrepreneurs, working alongside scientists and clinicians delivering advanced technologies and medical solutions to market. Located in the city of Surrey, British Columbia, housed in state-of-the-art facilities, the district, when completed, will be the largest of its kind in Canada and will comprise 8 city centres encompassing over 1 million square feet of multi-use space. Embedded within medical specialty clinics and educational institutions, this growing cluster of health and technology capabilities attract leading expertise across a wide range of new technologies, such as medical devices, health sciences, neurological imaging and rehabilitation, virtual reality tools, robotics, and artificial intelligence.
As a company that hires, we want critical mass. Smart people like to work with other smart people, and so we don't want to be an island. The more people are here, the more organizations that are here, hiring high-tech workers makes it easier for us to grow.
So we feel that this location in the Health and the Technology District is arguably the geographic center of the emerging economy here in the Lower Mainland.
Well, we have the ability to innovate. We have the ability to not have any bureaucracy holding us back. My background isn't medical, but combining the medical with, and even research with the technology, we're seeing fireworks happen.
Thank you. So what's important about this is that opportunity led me to become introduced to a number of lovely folks in New Brunswick. And upon getting to know New Brunswick and St. John and visiting the campus, and the campus also in Fredericton, we got to understand that there are many, many very critically important assets that existed on the St. John campus. And as a result of that, we co-created in partnership with the University of New Brunswick and Opportunities New Brunswick and other engaged stakeholders, including the municipality, on what we think is a very exciting and a very ambitious vision for St. John. Very similar to what you saw as a model in Surrey was the campus of St. John allows itself to complement and enable everything that's occurring and underway at the campus, but also through the Integrated Health Initiative, where we've got innovators and entrepreneurs, researchers, thought leaders, also working alongside, and this is a critically important part, alongside of clinicians and healthcare practitioners. What we found in the healthcare system was we had all the problems, we needed solutions, and sometimes solutions weren't readily available. But by building this type of an ecosystem and co-locating these agencies together, there's an opportunity to expedite and accelerate solutions directly to what are the priority problems. So this can be developed right here in St. John. It will be a place where not only the research and the science that emerges out of the university, but it can become integrated very, very quickly into the clinical systems whereby clinicians can have inputs and they can collaborate. And out of those collaborations, they can create technology-enabled solutions. And we don't necessarily have to go outside to find solutions and attract them here, but actually can generate solutions themselves. And what we have also found is this becomes very much a highly inspiring place where we do start to see youth, high school youth, wanting to become engaged, being inspired in the science and the health and technology related industries, wanting to be a part of it. And that starts to generate a talent pool that is very, very important as far as the future economies. So just moving on to the next slide, if we could, please. I refer to this as the trifecta. These innovation ecosystems, or very much referred to as a cluster model, would not be possible if you did not have leading edge university research capacity and capabilities, that you didn't have a healthcare system and a hospital, acute and other care services delivered at that campus, We've got Opportunities New Brunswick, who are really driving the digital health agenda and looking at the future jobs and economies for New Brunswick, but also from a private sector perspective, an organization like the LARC Group becomes an enabler and a catalyst to allow all of these agencies to work together and leverage off of the strengths of each, and then become something that is way beyond just the sum of its parts. If we could just move to the next slide, please. So here's the plan for the Health and Technology District in St. John. We're very, very excited. We've been working for the last 2 years on this vision. And currently you see just on the upper right of this slide, that is our current rendering for phase 1. So phase 1 will engage up to 50 new businesses, up to 1,000 new jobs, and approximately $50 million. These numbers were based on the economic analyses that we've worked with Opportunities New Brunswick, but also this is what we saw, this is what we experienced in some of these other innovative ecosystems. I'll get into the timeline, but soon thereafter, we are looking at phases 2 and 3, all 3 located on the entry portal to the St. John campus. And phase 1, 2, and 3 will all be generally co-located. But at the end of the day, 2,500 jobs, $100 million annually back into that community, and as well as just the investment on the construction costs of $70 million on these particular projects. So as we said, we started in 2018, we're now in 2021. We will be completing over the next year many of our commercial lease and partnership agreements in order to engage and ensure that the community and the market has been explored around who are the right types of tenants that would enable and complement the other activities on the campus, as well as we'll be refining and just finalizing the projects and the designs. And then in 2022, we will be breaking ground and starting construction, with by 2024 up, leased, operating, and most importantly, innovating and making a significant impact into the health innovation ecosystem there in New Brunswick. So a few things I just want to highlight, because this is what I saw coming from British Columbia, where we had some real challenges in the community of Surrey at the time. In fact, we would never have been considered a community that would have built anything innovative at all. And that was the reputation. We did identify, though, that there are some assets. And these were the first things that jumped out to us as we came to New Brunswick and met with New Brunswickers and met with the different organizations. There are extraordinary strengths that New Brunswick has. And if I just speak to cybersecurity just as one, but all of the innovative things that are happening across New Brunswick in not only the St. John campus, but also in the Fredericton campus, the proximity of a hospital relative to Dalhousie Medicine, a community college, and the university, it's very unique to see that consortium of organizations to be co-located. And there's so much opportunity to just connect them further. The synergies between UNB and the Integrated Health Initiative that Dr. Hof just spoke to is already underway. This is now just taking it into that next stage of commercialization, where those innovators and entrepreneurs that are building those technologies and solutions can actually now commercialize those into products that then can be exported globally and locally and have impacts locally. That pathway can be accelerated by the access to having the clinical environment where clinical trials can be expedited and accelerated, that you can validate prototypes, you can get your Health Canada approvals for new solutions much, much quicker. So this is a deviation from the former, more conventional trajectory you would see from the university if it was on its own. Obviously, UNB has a very bold vision, as Dr. Hof just pointed out, and this is there really to just enable and enhance that. It also, we have found, becomes an extraordinary asset around attracting, retraining, and growing your own people. UNB has had a strong reputation all the way over here in British Columbia for the students and the quality of graduates from UNB, but they they want to stay home. They need to have an opportunity to have jobs. They need to have an opportunity for successes. And this is an opportunity to give them that so that they can continue to stay and grow their families there in New Brunswick. And at the end of the day, it becomes a vibrant community, which I mentioned earlier. Each one is doing important work, but together it becomes exponential what they're able to do. Right now, as was mentioned earlier by Minister Shepherd, right now, there's no more challenging time as we emerge from COVID. I think, and I really appreciated her underscoring the social determinants of health, where we've seen disparities in how COVID has impacted many vulnerable communities. Now is a time to find solutions, because it's going to be challenging in the healthcare to be able to continue to have a sustainable system. We have to find cost-effective ways. We need to be able to enable those that need solutions to get to those solutions, particularly in rural communities where there's some extraordinary challenges such as transportation. So I would look towards New Brunswick as being very, very forward-thinking and seeing that digital health was going to be a future economy. And little did we know that the demand for digital health solutions was going to be so critically important now than it ever was in the past. So, kudos to New Brunswick and the government of New Brunswick and all the agencies here today for seeing this in the future and being in a state of readiness. I've said this before, and I'll just I'll say it one more time before we just go into a couple of notes to follow up. Creativity and innovation, I have found in my experience, emerges from the embers of crisis and scarcity. So some of the most innovative things I've ever seen in my healthcare career have been in communities that had very little to nothing, Indigenous communities that had absolutely nothing and were challenged by the health impacts. That's where we can really inspire some creativity and innovation. And I think St. John and the Health and Technology District, St. John, is going to be the place where we will see those being generated exponentially. And then I think I've just got one. So the LARC Group, why the LARC Group? The LARC Group is a family-owned company since 1972. They started trying to assist mental health in their community, and they started to redevelop some trailer courts into vibrant living environments. That was a commitment. They're very, very purpose-built. And they've gone from working with those vulnerable communities into becoming these transformative ecosystems that are really having huge, huge impacts on the communities in which they're supporting. So the LARC Group came really as an enabler, having that experience to say, this is what we learned. These are the pitfalls. This is what we have to be careful of. And this is how you remain committed to partnership and collaboration in order for all of these aspirational and inspirational goals to become a reality. So next steps, in collaboration with all our partners here, we will be holding the first of many virtual symposium until we can be in person again, where we're going to take all the learnings from the health plan, the provincial health plan, but also gaining access and insights from the business community, the innovation community, the technology community, internal stakeholders, external stakeholders around all the opportunities and possibilities there are, and get everyone's input. This is going to be critically important for the future of St. John. We want to identify priorities, healthcare priorities, by working with the Ministry of Health, working with the frontline health clinicians. They really usually can identify those priorities very, very quickly, as well as the citizens. We want to understand, how do we strengthen the economy? How do we build jobs and opportunities for people who graduate from UNB to come and stay and contribute to their communities? Obviously inspire the citizens to become entrepreneurs. And we've really seen some huge successes around this. Young people really want to be inspired, and if we can make it easy for them to come and want to be engaged, and those are our future leaders. So we need to invest that time in them. And then of course, the research and the commercialization, building partnerships. It's not possible without partnerships. There's no one entity that can do this on their own. It's absolutely imperative that we leverage each other's networks. So over the next number of months, we will be engaging. We'll be engaging with the community. We'll be engaging with the market. We'll be identifying who we believe would benefit from a co-location on the campus, because it has to be a win-win. Every single entity and every individual that is there operating, working, and supporting the campus needs to walk away with how this has deeply benefited them, how it's a win-win, and how everyone is able to be inspired by this and to become a part of it. So that's our goal. That's our grand vision. There's lots to come, and we're very, very excited to be working in collaboration with all of you. So thank you.
Well, thank you very much, Rowena, for what I think really capstones the initial presentations here today. Petra, in her presentation, talked about the 5 pillars of an integrated approach. Minister Shepherd talked about the necessity of cross-departmental work to achieve health reform. And I think what you offered us is a view of the benefits of cross-sectoral partnerships in achieving positive outcomes. And in this case, with government, academia, and industry working together with community members and community organizations, there is a real opportunity to see positive social, economic, and health sustainability outcomes for New Brunswick and New Brunswickers. So thank you for your intervention. Thank you to all 3 of you. And I'm so happy that you'll sit tight with us as we transition to the next part of today's session. And as I do that, I want to remind all attendees, I've seen a few questions to this effect, that yes, today's session will be recorded and shared. We will be appending all of the presentations and materials to our webpage so that it can be housed there, so that folks who may have to leave or who couldn't join us will have an opportunity to see what was discussed today. With that, I want to move to the next part of today's Shaping the Debate public dialogue and introduce to you 4 accomplished UNB researchers. And I'll remind audience that their exhaustive bios are up on our webpage. Each of these fine folks have vast experience leading evidence-informed, solution-oriented, innovative projects and initiatives that have had, are having, and we expect will continue to have positive impacts on health outcomes for New Brunswickers. And they are, as they appear on screen, as they start to populate the screen, I should say, Dr. Shelley Doucette, who is the Jaroslawski Chair in Interprofessional Patient-Centered Care and an adjunct professor at the Faculty of Medicine at Dalhousie Medicine, New Brunswick. Dr. Ted McDonald, who is the director at UNB's New Brunswick Institute for Research, Data, and Training. Dr. Eric Shemy, who is the director of the Health Technologies Lab and a research faculty member at the Institute of Biomedical Engineering at UNB and an adjunct professor at Dal's Medicine in New Brunswick. And Dr. Kelly Scott Story, who's an associate professor in the Faculty of Nursing at UNB and the director of Community Research, Scholarship and Teaching at Fredericton's Downtown Community Health Center. Thank you all for joining today. Thank you for the work that you continue to do on behalf of New Brunswickers. This is meant to be a curated discussion. I've got a couple of leading questions to give each of you an opportunity to talk to folks attending about some of the work you're doing, but I'll encourage each of you to, have a discussion amongst each other and talk about some of the innovative, entrepreneurial, and collaborative approaches that you're working on. And if you'll permit me, I think I'll start with Dr. McDonald. Ted, we've heard already a little bit today about some of the growing gaps between the realities of the current healthcare system as well as what is available opportunity-wise for us to build dependability, sustainability, and future readiness. And part of that future readiness is an ability to be responsive within the healthcare system to changing needs. Quick and efficient reconfiguration of the healthcare system at a minimal disruption and cost is I know what we are striving to achieve. And to do that, we need evidence and data. So why is data important? How do we collect data appropriately, safely, keeping in mind privacy considerations of New Brunswickers? And can you talk to us a little bit about the work that you and folks at the Institute are doing to procure evidence and data and share that knowledge widely with community members as well as decision makers?
Thanks very much, Matt. I'm glad I had the question in advance. It was a very long question. I don't think I could have kept tracked all that. So the question I'm going to start with is, how do we know whether new policies and approaches are going to lead to better outcomes? That means improved health of our population, lower costs, better experiences. Evidence-informed policy, the phrase, it's something we hear often, but what it actually means is using data to see whether something works and change it if it doesn't. And so what do we mean by data? Well, it's really our own experiences. So almost everything we do results in data generation somewhere. And in particular, our own governments collect a mountain of data on us. When we see a doctor, when we enroll our kids in school, when we fill a prescription, when we have a baby, we file our taxes. But data itself isn't valuable in of itself. And to quote a recent report that I read the other day, the value is created when it is gathered completely and accurately, connected to other relevant data, and done so in a timely manner. And I'd add that this is necessary but not sufficient, because we then need to transform data into information and then into knowledge. So we need research, and that's where research comes in, to use the data to understand why policy or program works or doesn't, and why it works maybe for some people and not others, and then how to improve it. And as with many other jurisdictions, one of the main obstacles New Brunswick faces to more effective use of data is that data are siloed within departments or within agencies, and thus it's very difficult to connect. And this is really important because people don't live their lives in silos. And so, for example, to pick any number of possible examples, our education affects our health affects our employment, and vice versa. Our social and family interactions affect everything. And you just think about the role that housing, sustainable, secure housing plays on all those outcomes. And I'm going to deliberately misquote Mr. Shepherd and say, bring on the sledgehammers. That is, just for the press, that is a deliberate misquote of what her comments were. And that's where NBRDT comes in, New Brunswick Institute for Research, Data, and Training. We were established to overcome some of these challenges. So to be able to link data at the person level and use it to understand how policy affects people in the short, and more importantly, in the longer term, beyond the 3-year or 4-year election cycle. And what we are is a provincial data custodian research data center as defined in legislation. And we have anonymized, so kind of confidentialized versions of more than 60 person level data sets from the provincial government, from the regional health authorities and other organizations, including organizations such as Immigration, Refugee, Citizenship Canada. And with our stakeholders, we conduct research and evaluation using these data holdings. So just to give you a few examples of the work that's currently underway, we're looking at transitions from home care to alternative levels of care in hospital. And this relates directly to the ability to help people age successfully in place. We're looking at mental health, substance abuse, and suicide. We're looking at community vulnerability to the direct and indirect effects of COVID, including mental health effects. And I noticed one of the questions in the Q&A was about mental health effects in COVID, and I'd be happy to follow up with the commentator after on some of the work we're doing there. Socioeconomic status, barriers, and COVID testing, and the health effects of one's environment, living near green space, urban density, proximity to industrial activity. They all use big linked data files. We're also using our citizen database, and this is based on our Medicare registry, linked with student graduation records to study graduates' decisions to stay and work in New Brunswick. And this in particular includes our nursing graduates. And this is all done with privacy-first approach to ensure confidentiality and privacy for all New Brunswickers is protected. When people hear what we have, sometimes there's a what you have that, and then we reassure them that the safeguards that are in place are just gold standard. Confidentiality, privacy of individuals comes first. And then the last part of your question, through the Institute, we're also connected to regional and national networks of research data centers. It allows us to have a seat at the table and benefit from the resources and expertise of these larger provinces. And as people who know me know, I never say no to an opportunity. And we're even leading a national working group on data privacy around personal health information. And the last thing I'll mention is through our work with the Maritime Sport Support Unit, we're making patients and citizens equal partners in our research and ensuring that their voices are heard. So thanks, Matt. Thanks for the opportunity.
Well, thanks very much. I want to offer Shelley, Eric, and Kelly an opportunity to intervene if they wish. Maybe some of the experiences you folks have had taking data, translating that information into knowledge that can be actionable in some of your programs or initiatives.
I can speak first, perhaps. I know I've worked a lot with TED in the past. I think the challenge that we've experienced is getting timely access to data, because it is such a process to get access to the data. So maybe Ted, if you could speak to that around just some of the challenges we experience in terms of, like, we have the project, we want to evaluate the outcomes and we want to access the data, but sometimes the project we're doing doesn't line up with either when the data was collected or even getting access to the data. So maybe you could speak to that, Ted.
Yeah, just briefly, I think as we grow and develop and we become more kind of integrated with what government does, and they become more familiar with what's happening, we are constantly working on improving our processes, getting data in a more timely manner. And I think with COVID, that's really increased the impetus and the demand for, well, we need to know what's happening now because it affects health decisions now. So we work a lot with our provincial partners to try and tighten that timeline so that we can help researchers, including our own research as well.
I can jump in a question.
I see both Kelly and Eric unmuting.
Sure, I'll jump in with a question, Ted. So, I mean, we've seen tremendous value out of these data sets and being able to answer questions that we have. So the availability of the data to bring it together to answer those questions. As somebody who does machine learning research, what I'm always excited is the ability to find the questions we didn't know we had. Do you have an opportunity maybe to talk a little bit about the ability to sort of mine that to find new things?
Yeah, we have some preliminary discussions with how can we take our secure repository of data, which is in a closed air-gapped network on UNB, and then somehow marry it with the high computing capacity that's required to do the machine learning. So those discussions are ongoing. It's something that the value is immense. It's just a matter of figuring out the privacy and the resources to do it. But if we can continue talking about that, and anyone else who's on this meeting can jump in on that and help make that a reality, this is where we're going next, and we want to be part of it.
Great.
Thank you, Ted. I had an additional question. So we know university students are vital to research. And I'm wondering if you could talk a little bit about the new Pathways to Professions programs and the opportunities to impact healthcare through such innovative initiatives like that.
Yeah, again, briefly, as it turns out, we started a program last year called Pathways to Professions. It lines up with the university's mandate and focus on experiential learning. And it's all around data science and data literacy. And so we bring in students, we give them a summer job, they work with our researchers, they're learning invaluable skills. And going through that, and the program is going to be expanded probably by a factor of 4 this year. And one of the things I've learned is if you take some smart students, and some of them don't have any sort of formal training in what we're looking at, and you give them the opportunity, they do amazing things. And so it's really sort of energized us to expand this program, and it aligns with both the universities and the province's focus on experiential learning, helping students get kind of job-ready skills. And our niche is around data science and data literacy, data visualization. If it starts with a D and rhymes with beta, then that's where we're working.
Well, thanks very much. And Ted, in addition to your availability to government partners, I know that your institute is also available to community organizations and other actors out in the sphere who wish to have better knowledge through data.
We work extensively with not-for-profits. We have a long-going project with in conjunction with social development in New Brunswick and St. John, targeted around poverty and helping people move out of poverty. And by linking the community level, where you get a lot of service delivery, you get a lot of interaction with figuring out what works and what works better to help them tailor their programs.
Thanks so much. Shelley, I'm going to come to you because I think an important part of the conversation that we need to have is around system navigation. And you've got a lot of expertise dealing with folks who are challenged with trying to figure out where to go to receive the supports they need. And that could be someone facing the onset of dementia or their caregiver, a young person with complex needs and their parent. It's a matter of equity in many ways. And it's a matter of ensuring that people are able to receive the services they need for the overall health outcomes of our entire province. Maybe you can speak to a couple of the initiatives and the overall work that you're doing, how it can have an impact here in New Brunswick and beyond, and what lessons we can learn and take away and integrate into a sustainable, future-ready system.
Great, thank you. So thank you for the invitation to speak today and share the research our team is collaborating on through UNB Center for Research and Integrated Care. In our lab, we have several ongoing research projects focused on improving health service delivery here in New Brunswick and elsewhere. And we collaborate with a large team of partners from a variety of backgrounds. For example, we have patients and caregivers in all of our projects, together with researchers, community stakeholders, clinicians, and decision makers. And like Ted was just talking about with the trainees, they're also key partners on our team. In fact, we just hired 15 full-time summer students who started yesterday, who will work with our research team over the summer. And it really provides trainees with opportunities to be actively involved in promoting changes in health policy and practice. In terms of the research we do, our team first conducts needs assessments on the gaps and barriers to care in New Brunswick, and then we develop, implement, and evaluate new service delivery models to address these gaps and barriers to care. And the benefit of this is because it's a living lab, we actually get to see the impact of the research we conduct in real time with our patients. So this afternoon, I'm just going to highlight a few of the examples, and following from the question you asked, Matt, around navigation, I'll start with some of the work we're doing around navigation. And just to give a bit of context, the role of patient navigator is increasingly being implemented across North America and abroad to help patients and their families navigate through what we know to be a complex maze of fragmented services, providers, and programs across settings and sectors. And we heard about that from the minister at the beginning as well, that this is a common concern. And one example of a patient navigation program we have been implementing since 2017, following a province-wide needs assessment, is Navicare SwanNavi. And this is a research-based navigation center for children and youth up to the age of 25 and their families. And so the community-based center employs a bilingual patient navigator who is a registered nurse, and she assists youth, family members, and the care team by helping to coordinate patient care, facilitating transitions in care, for example, when youth transition from pediatric to adult services, connecting families with resources and services, and acting as a resource for the care team. Because one of the interesting things we found from our needs assessment is that it's not only the families who need help in navigating the system, but even care providers also experience challenges keeping up to date and current with all of the services and programs available. We're also partnering with the MB Trauma Program as well to implement the patient navigator role in the hospital setting. And we know that injury-related trauma patients typically experience gaps in care, both while they're in the hospital, but also while they transfer elsewhere, whether that be to their home, to a rehabilitation facility, or another hospital. And one of the things we've learned with implementing Navicare is that it's really challenging to implement a navigation program outside of the publicly funded healthcare system. And so this project with the trauma navigation project has the advantage of being embedded within the hospital setting. Another population we're piloting patient navigation is for people with dementia, their caregivers, and the care team. And we've learned through our research that dementia care is extremely fragmented, uncoordinated, and often difficult to navigate. And again, following a province-wide needs assessment, we're currently piloting a dementia navigation program where we're actually embedding 8 patient navigators. We're planning to embed 8 patient navigators in community health centers across Horizon, Vitalité, and First Nations communities. And we're also partnering with groups across Canada, so Healthcare Excellence Canada and Dementia Advocacy Canada, to share the lessons that we've learned to spread this innovation to other provinces and territories. Just to mention as well, in addition to patient navigation, another innovation we're testing is case management in primary care settings. In this model, a case manager who's either a registered nurse or social worker is assigned to the patients who are the highest users in those primary care clinics, with a focus on those who frequently use the emergency room and have at least one chronic condition. So the case manager works collaboratively with the care team to assess, plan, facilitate, and coordinate care across all sectors to improve individual and health system outcomes. So we're currently implementing this case management intervention in 10 settings across 5 Canadian provinces. Here in New Brunswick, we've partnered with the St. Joseph's Community Health Centre and Harbour Health, both in St. John. And we're already seeing improvements in individual outcomes, such as improving the experiences and health status of patients. And we're also seeing improvements in health system outcomes, for example, curbing the ineffective use of ERs. So just before I wrap up, I also want to share that in addition to developing new integrated service delivery models, our team also evaluates existing models of care, such as the NP-led clinics that are being implemented in Moncton and soon in Fredericton and St. John. And given that these NP-like clinics are new, the purpose of this research is actually not to explore the impact, but rather the actual implementation of the first clinic in Moncton. And our goal in conducting the evaluation is to inform ways in which the current clinic processes can be improved, and also to inform clinic implementation as the NP-led clinics get rolled out across other regions in New Brunswick. So we have other ongoing projects in our lab, and we always welcome other collaborations with anybody who's interested in this research. Before I end too, I just want to thank our funders as well, particularly the Jaroslawski Foundation, the New Brunswick Health Research Foundation, the New Brunswick Innovation Foundation, and the Canadian Institutes for Health Research, and everyone attending today for being part of this important discussion on sustaining healthcare in New Brunswick. Thank you.
Kelly, I don't want to preempt where I would like to focus the essence of our discussion with you, but I know you've got work, significant amount of work done reaching vulnerable populations with aspects of navigation of the system. I wonder if you have anything to add and or anything that can complement some of the work that Shelley has spoken about.
Yeah, certainly in our consultations with community, the importance of the navigator role comes up over and over again. And we're seeing that from our New Brunswick citizens. So the work that Shelley and her team are doing is vital to looking forward to the sustainability of systems within healthcare, and to help citizens in New Brunswick actually get access to the healthcare services they need within a very complex system. And so it's great work, Shelley. Kudos.
Thank you very much. We actually, our team just hosted a national conference last month, and it's amazing to see the work that's being done across Canada right now. So we hosted the first annual Canadian conference in patient navigation, and there's work being done all across Canada in this area. We even had presenters from Australia and other countries as well. So it's definitely an emerging field, and I think there's some really exciting research that's taking place in this area.
I can jump into the question for Shelley, if that's okay. So I know you do a ton of work on a number of different projects, but one of the big areas you look at is sort of evaluating these different delivery models. And I'm wondering, given now that you've sort of compiled multiple projects like that, if you would say that the issues are more around finding new delivery models that work, or implementation of existing models that do work, but scaling them to the broader population?
Yeah, that's a great question. I think it's a combination, and I should say too, the service delivery models that we've been implementing, they're not new. We've not developed patient navigation. We didn't develop case management. We're partnering with researchers and care providers and decision makers in other regions across Canada who are already implementing these innovations, and we're bringing them here to New Brunswick or spreading them to other populations. But I think a lot of the fundamentals of what we learn across all of our projects can help inform whatever project we're implementing. There's the key components that are critical in all aspects that we know. So for example, we've found that it's most effective when we're implementing these interventions if we engage patients, caregivers, decision makers, clinicians. Once everybody's engaged at the outset, we've found that regardless of what the intervention is, those interventions are most effective and most sustainable long term. So I would say that's been our greatest learning is, and also another learning is really embedding what we're doing within the healthcare system. So a couple of the things that we've done in the past have sort of been on the periphery, on the outside of the healthcare system, trying to make changes in the system. But most recently, the work that we're doing, we're actually implementing it with those folks involved in the setting, and from day one, thinking about the sustainability, so that we're not just coming in for a year, doing a research project, and then leaving. We're trying to, when we're doing our research projects, we're trying to implement them in such a way that, you know, say it's a 24-month project, there's a plan in place for after 24 months, how, if it's shown to be effective, that they continue on as well. So I guess I would just say that for all the projects, sometimes they're new, sometimes it's changing existing models, but I think ensuring that we engage all of the important stakeholders and have a sustainability and plan in place is what's been shown to be most important.
Agreed.
And Matt, if I could just make one very quick comment, it's not really a question. This is both for Shelley and Kelly. When we talk about administrative data, what I was talking about, one of the big gaps is if you're not using the system, if you're not checking into the hospital, if you're not seeing your physician, we don't see you. And we know that there's a large number of people who are going without services. So the work that Kelly and Shelley do in identifying the particularly vulnerable populations and connecting them with the system fills a big gap that we have with the data that we see.
Well, and you offer a great transition into where I wanted to go next, which was to talk about what I think is a jewel of downtown Fredericton, and that's the Fredericton Downtown Community Health Center. And Kelly, that center has had a tremendous impact reaching vulnerable populations where they are and helping redress some of the health inequalities that exist within the system. I wonder if you can talk a bit about the unique relationship with the Horizon Health Network and UNB and how that allows the center to offer equity-oriented services to priority populations, and how it can serve as a model for sustainability and future readiness of our healthcare system.
Absolutely, and thank you, Matt, for that question. So I'd like to start by thanking Minister Shepherd for being here today and engaging with us around healthcare reform and opportunities. And I acknowledge that your job is incredibly difficult and that healthcare reform is complex at the best of times, let alone during the middle of a global pandemic. So I'll start by building a bit upon what Matt has just said in terms of the Fredericton Downtown Community Health Center and provide a bit more context. So the FDCHC is the only model of its kind that I'm aware of in Canada in which the Regional Health Authority and the university actually have a joint MOU to operate a community health center. And the partnership is what is key to the success of the center and its impact. And within this partnership, we're able to leverage each stakeholder's knowledge, expertise, strengths, skills, resources to do even greater things than what we could accomplish in our individual silos. And that seems to be a common theme I'm hearing throughout this panel discussion. So the center itself serves some of Fredericton's most marginalized and vulnerable populations who account for the highest healthcare expenditures. And so those are people who are homeless, near homeless, newcomers, refugees, immigrants, vulnerable seniors, those with problematic substance use, and trauma survivors, just to name a few. And there's been a long time recognition for the need to take health services out into the community to the people who need it most. And that is what we do at the Fredericton Downtown Community Health Center. And because of its unique makeup of the center in it being a joint MOU, it results in the opportunity for unique collaborations with regional health authorities, university, government, community agencies, and the citizens it serves in really innovative ways. And UNB functions within the within the center within that partnership, I guess, to improve primary healthcare by being a leader in healthcare innovation and an influencer of social change through things like research, teaching, experiential learning, and community activism. And to just give you a few examples, the center can be part of innovative solutions, and we are a part of innovative solutions. So the center was set up as a physical address for social development checks, or social assistance checks, sorry, for those who are homeless or have transient housing. You have to have a physical address in order for the check to be sent to you. And that check is very important to the health, wellness, and safety of those people, that vulnerable population. So we actually partnered with social development on this initiative, and it was a direct result out of one of our other initiatives, which was when the center led the Out of the Cold initiative during the winter of 2019 and 2020. And this need for, or this gap was identified in which people weren't actually able to access their social assistance checks. So the center is able to be nimble to emerging community needs, and that's probably one of our greatest strengths. The center has recently led the COVID response for the Out of the Cold shelter, and that was last winter. And so that was the creation of a 24-hour low barrier homeless shelter that was required because of the current public health restrictions within the province at that time. And also because UNB functions within the FDCHC as a not-for-profit, it means that we can apply for community, provincial, and federal funding and grants that our partners cannot apply for. So in recent months, we've received over $100,000 to help fill gaps in services related to COVID. So last summer, we were able to apply for funding for a cooling shelter in the summer for marginalized groups who were unable to escape the heat of the summer because of COVID restrictions in public spaces. These individuals could no longer go into restaurants or malls or places to escape the heat. The center also addresses gap in services by using research to impact change. And through the center, UNB is co-leading along with Horizon Health, the Regional Health Authority, so a partnership for the Healthy Seniors Project. And that's led by Dr. Tracy Rickards, a UNB faculty member, as well as the nurse manager of the center. And she's the principal investigator of this $1.5 million initiative for a mobile seniors wellness network. And this innovative project has the potential to contribute to the ability for our seniors to age in place within New Brunswick. So very much in line with what we heard Minister Shepherd speak about. In terms of addressing gaps in our current healthcare system, we know that 1 in 3 women are survivors of intimate partner violence, and intimate partner violence has significant effects on mental and physical health. It's also extraordinarily costly to the healthcare system. And this is where the province and the people of New Brunswick can benefit from collaborations between UNB researchers, government, and regional health authorities. And as an example, I'm a principal investigator leading a national randomized control trial for a health promotion intervention for women who've experienced violence. And this is called the iHeal program. And this was a program funded by the Public Health Agency of Canada in excess of $3 million. And we had the opportunity in New Brunswick to take up this evidence-informed program at the center, at the Fredericton Downtown Community Health Center, as a pilot project in New Brunswick, and then work with government, the regional health authorities, and our community partners to think about potential scale up throughout the province and what that might look like in terms of scale up and sustainability. And this is an example of rapid translation of evidence into practice that benefits New Brunswick citizens. And importantly, the center engages UNB students in experiential learning, education, training, and research. And we've already heard some of those examples in other sectors. And it gives them real life experiences that we know positively impacts learning and success and better prepares them for the workforce, as well as being good global citizens, while all the while giving back to the community that they reside in or learn in. So we're currently in the process of growing our experiential learning opportunities of the center with both undergraduate and graduate students at UNB on both campuses. There's opportunities for students in law, kinesiology, psychology, arts, sociology, nursing, business. Really, the opportunities are endless that we've mapped out and identified. And students are already involved in these community projects through the Downtown Community Health Center. As an example, nursing students recently in their community health course completed a project or a report advocating for mental health courts in New Brunswick. And this was identified as an urgent community need because of the population the center serves. Additionally, we're collaborating with UNB Law to look at the potential of offering law clinics run by UNB students through the FDCHC, so that access to being able to help very vulnerable and marginalized sectors of the population. And maybe I'll end by saying that in the last few months, my team has been working really closely with various government departments, PEDAL, Health, Public Safety, Social Development, to discuss exciting initiatives through the center in population and community health. And what has become really clear to me is that there are great synergies that either we're often working in the same space or thinking about similar initiatives, or we have similar outcomes and goals in mind. And so in a province that's not abundantly wealthy, we have an opportunity to work better together and to leverage each other's strengths, expertise, and resources. And from a university perspective, the value added is really what the faculty and students can bring to these programs, initiatives, policy, and decision-making processes as engaged stakeholders and researchers. Innovation and research is what we do best at UNB. And so to leverage this to transform services, systems, and policies that impact health in New Brunswick is actually really very exciting. And so maybe I'll end there.
And we appreciate just how important that center is to downtown Fredericton. And I'm going to do something a little creative here because we're running towards the end of our time, and I want to give Eric an opportunity to speak to the importance of digital health, but I'm going to do that by transitioning into the Q&A section, because it was a question that came to us from a number of folks in the registration for today's session. So I'll ask Minister Shepherd, Ms. Rosati, and Dr. Hauff to join us here for the last part. And Eric, I'm going to give you the chance to answer to start by answering about the importance of digital health to New Brunswick's future healthcare sustainability. You've been involved in a number of neat, technologically focused initiatives. Maybe you can share about the importance of the work you're doing, and then we'll open it up to one or two others who want to talk to to that aspect of sustainability and future readiness in our healthcare system?
Sure, I'd be happy to. I'll make one small correction there, Matt. So not technology focused, technology enabled, person focused, right? So, and that's one of the exciting things about digital health in general is that, you know, I got into this as an engineer wanting to help people, but the financial and economic impacts and potential of these digital health solutions are so large that we can make both health impacts, societal impacts, and economic impacts all at the same time by leveraging these situations. So, you know, we've seen COVID create this opportunity for digital health innovation and acceleration. The evidence has been there for many, many years, but it just so happened to be that the risk associated with transforming systems to these digital systems was perceived to be great. And so COVID came along and made it a situation where not adopting them became riskier. So we're seeing a lot of movement in these spaces. And when we talk about digital health in general, I like to think about how people have evolved to use technology in their daily life. If you think, it doesn't have to be something complicated. A lot of people think of medical technologies of having to be fancy equipment in a hospital somewhere. People use technology to better their own health all the time, whether that's using the internet to stay connected with loved ones, or these patient navigators to access information for how to get those things. So there's a role for digital health in not only supporting the current healthcare system, but transforming the current healthcare system. We've talked a lot about taking populations that are at risk or helping people in particular situations, but we know that the current healthcare system evolved out of a need for acute care. As we move into sort of this new age of healthcare, we need to move towards this more chronic care and proactive care. And so that really, I see that's where technology has this opportunity to come in and create opportunities for new delivery models, new methods of engagement, empowerment of individuals in their healthcare before they get to the point where they say, well, okay, I'm not well now, I need an intervention from somebody else, trying to get them upstream so that we can engage them in that process early on. So of course, we have a number of projects in that space, working in the digital health space. One of the nice things that I get to do is work with a lot of industry partners across the province. We have a lot of players in the province that are really driving things nationally that maybe don't get that same attention regionally, but there's a lot of exciting stuff happening in this digital health space here in the province. So maybe in the interest of conversation, we can open it up from there.
Well, I know, Minister Shepherd, you're very familiar with some of the pilot projects that have been introduced in this project. Kelly spoke briefly about the Healthy Seniors pilot, and you, in your time as Social Development Minister, introduced some of those. There must be applications that you see that can feed the future healthcare reform.
Well, thank you. And I can, and you know, this has been an interesting conversation because COVID has taught us so many things, and the one thing that it certainly has taught us is that virtual care has a place in our healthcare system. And you know, before this, you know, we're going to deliver a new healthcare plan for the next 5 years. Digital health and virtual health has never been a part of that really. To a great extent before. So now it has to play a part, and we have to look at what that accountability measure is and how does it better our outcomes. But at the same time, you know, maybe it plays a bit to the transportation issues that we have in this province for people accessing healthcare services. So there's going to be really good components, and as long as we make the patient the center of our agenda, then we're going to utilize it to the best of our ability. With regards to the HSPP projects that we've done, yes, as Minister of Social Development, I was able to participate in rolling some of that out. And as that data comes in, and speaking of data, it's quite exciting, actually. You know, I know how academics get a bad break when people think that academia isn't that exciting. But quite frankly, this conversation just epitomizes how exciting academia is in what it helps to do to support good public policy. And so that's exciting to me. And I recently had a presentation from the Innovation Hub talking about, you know, how research informs practice, and practice informs research, and that circular motion needs to continue continue on and on every single day so that we are constantly assessing and reassessing ourselves to ensure that we're getting the outcomes we want. So I'm, I'm excited about this kind of work and data and want to be kept informed every step of the way.
Well, that's fantastic. I want to slightly shift focus, and of course, a lot of these themes overlap, so folks can feel free to insert their own expertise and commentary. But Dr. Hauff and Ms. Rosati, we had a question about why is infrastructure so important to help house the education and research components of this work in integrative. In the Integrative Health Initiative, but also for enabling entrepreneurship and innovation. Maybe you can each speak to the importance of the critical infrastructure needed to help make this change happen.
Yeah, and I might want to start with the Health and Social Innovation Center. So it is really important to realize that this is purpose-built infrastructure. This is not just another fancy building on a university campus. This is to enable us to achieve the goal of educating more students into an interdisciplinary integrated approach to health, to expose more students to experiential education opportunities, to get them into communities and get them connecting what they see with what they learn. It is about finding the right space for those researchers that we don't have available right now so that they can actually have these integrated approaches and breaking down those silos and work together in a space where they see each other, where they are around each other, where they inform each other and inspire each other. It's also showing, again, this circle of research and education and community so that there's a space where this all comes together. And so it's important to notice that these buildings are purpose-built for achieving a goal that we cannot achieve with the infrastructure we have right now in place.
Just to add to that, I think there's a couple of things. One would be what I've seen, I've witnessed this is so much organically that happens in these ecosystems that weren't even intended or planned. It's what happens naturally when individuals or entities that weren't expected to ever work together suddenly work together, and there's a new creative tension that comes from that, and I think some really innovative ideas that come from that we wouldn't be able to capture in any other way. It doesn't necessarily happen when one travels to another, but in fact, you know, we joke that we put a coffee shop in the middle of it, it forces people together and suddenly new conversations happen. And we've certainly seen that. We saw gamers that then became leaders in virtual reality technologies in a surgical system, things like this. They never would have had a conversation together before. But one of the highlights I just also want to mention and applaud everything that New Brunswick is doing, which is why I was so inspired by everything that was happening there, is the agility of New Brunswick as a community to be doing these things. If you look at the virtual health, we had so much resistance to virtual health over the past 15 years, to be honest. And there were always reasons and rationale as to why it wasn't the right time. But I always look to New Brunswick and the strength in the cybersecurity. Those are some of the issues that really cause people a lot of tension around moving those things forward. But New Brunswick, you've mastered it. And so why wouldn't you go to the masters to say, okay, if this is required, we need to do this. This is patient-centered. These clients cannot access care in their community. They can't get it. This is a more cost-effective way to actually give them mental health care. I'll say, for example, if there was no virtual mental health care, a lot of people really would have suffered much, much more than they did already. So we have to continue that, but New Brunswick is so well positioned to take a lead on this just because of your expertise in the cybersecurity, which is usually one of the #1 barriers that every other province would present around why they can't sort of globalize that type of care delivery model.
Well, thanks very much for that. And I assume when you're talking about people who wouldn't otherwise normally meet, you're talking about Eric, the engineer, meeting the health administrator, or the nurse, or the doctor in the coffee shop. So there's tremendous opportunities there. Eric, I'm going to give you a quick intervention and then I'm going on to the next question.
Sure. So, I mean, I agree with this. I mean, you know, we do have a tendency as engineers to sort of get focused on the widget that we're designing. And so we're always very purposely careful as part of the design of these systems to, as was mentioned by some of the other speakers, collaborate pretty heavily. I like to say I'm an engineer that likes to work with non-engineers for that purpose. But it's right, those connections are really important. And if I can just take the opportunity to throw it out there, an example of that. So the Institute of Biomedical Engineering at UNB is actually a world-renowned institute. If you go all over the world, they will know where we are and what we do. But in New Brunswick, we're kind of a hidden gem. And just in that one facility, we've got engineering faculty, staff, students mixed with prosthetists, occupational therapists, physiotherapists, clinicians from Stan Cassidy. So a highly integrated environment where we have patients and engineers and students learning together. So that's why connecting with Rowena over the last few years has been so inspiring to see that sort of at scale, at that large scale integration of everybody together. So I'm equally as excited about the growth of this system.
Well, thanks very much. Just shifting focus back to something that was mentioned a number of times in our presentation, and we've received questions previous to and during today's session, and that's around the issue of mental health care. Ted, you talked about some of the data and evidence that has been shared by your institute on what I think a lot of people anecdotally already knew, which is that COVID-19 has affected people's mental health. Minister Shepherd, you talked about the importance of the 5-year plan that you're working on. Ted, maybe I can give you a chance to open up with what some of we've learned, and then happy to have Minister Shepherd elaborate a bit on her plan and others to share their thoughts as well.
Yeah, I think when we think about in New Brunswick, we think ourselves as reasonably fortunate in terms of the number of cases of COVID, the number of deaths from COVID. But even if there haven't been many cases, we've all obviously been very, very much affected. Our kids, the way our kids are getting educated, the way we've had to interact. And so some of the recent work that we've done specifically on the mental health effects of COVID, one of the maybe not so surprising results is that it seems to be a disproportionate burden on young people, that you might expect them to be more nimble and resilient and adaptable, but that seems to be the group that seems to be suffering most. And we're continuing that research. We're going to update that again. And when the last survey was done, it was sort of coming into the end of the summer when maybe people were feeling pretty good about it. And now coming through the long winter of lockdowns and restrictions, it'll be very interesting to see what that is and what the effects are, and in particular for our younger people.
Well, and I can just add that certainly just in February we tabled the interdepartmental 5-year action plan. And I think it's really important. Again, I go back to interdepartmental because none of this can be done in our silos. We must be collaborating with our partners and our sister departments to make sure that our services are all encompassing. And so not long after that, we had a tragedy in the Fredericton area, which really kind of gave rise to focusing on crisis care and near crisis care. And so one of the things I appreciate about the action plan that we've tabled is that, we really need to understand and ensure that we're offering services to individuals at the right place for their right needs. And so the step care model is going to be, a good part of our strategy in helping to identify where people should be with that level of care and ensuring that they don't have to go through various steps in order to get to where they need to be, that we can step them into their care at the appropriate level at the appropriate time, and then have that supportive system in place that keeps them supported throughout their mental health journey. Some people it will be very short-term intervention, others it will be longer terms, and we need to be prepared for that. So this data is going to really be a part of what we need to do. And as we go into specific communities, especially when it comes to prevention, we've talked about the Icelandic model, which is a bit of a process to understand your community, to understand what those community needs are and where we need to focus, and then ensuring that we put those community supports in place that help communities come together. And so I'm excited about this, and I know that it's not a switch. It is a bit of an evolution, but it's got to be an evolution that we appropriately support, and we sort of accelerate it to the best of our ability, and that's our goal.
Go ahead, Kelly.
I was just going to add to further position UNB within the dialogue. UNB is responsible for educating the next generation of healthcare professionals. And so we pay attention to critical changes within the province, within the demographics and with needs. And as an example, you know, knowing through your healthcare reform plan, Minister Shepherd, mental health is a priority, and we're certainly seeing that within the clinical settings and within the community settings. So being responsive to that, you have faculties such as the Faculty of Nursing, I can speak to that because that's part of what I'm part of, you know, already looking at reforming the curriculum in order to meet the needs, in order to better prepare the next generation of healthcare professionals. So it's a beautiful intersection of not only what needs to happen in terms of programming and funding, but also what needs to happen in order to better prepare the healthcare professionals to be able to deliver those types of services in the province.
And that was a question that we received numerous times as people were sending in their questions, which is the role of nursing in the nursing profession in general. Certainly UNB has a long history of training nurses and educating nurses, as Kelly mentioned. But we're challenged with a staggering demand and demographics that will only increase that demand. And people have been reading commentary recently about the challenges in recruiting and retaining nurses. I wonder what tools are available to us, whether they be educational, policy-wise, or other, to ensure that we have the nursing complement that we need for a future-ready healthcare system.
Well, you know, recruitment and retention is always topic of the day, and every single day, because all of our medical professionals are extremely valuable to our system and our allied professionals as well. Nursing, no debate there that it is it's a priority for us. And so we have increased with our partnership with Petal on our nursing seats, and we put in the bridging program for RNs to go to nurse practitioners. I would like to see that evolution of every step of personal support care, whether it starts at a lower level, working through to LPNs, to RNs, to nurse practitioners. I'd love to see continuum of educations in place so that people can see themselves evolving through their careers to different levels. And I think that certainly would be unique for New Brunswick, and I think it has a place. It has a place to be. We've got we've got a large amount of our nursing capacity that will retire. And so we have to ensure that we have those seats. So we are also working with internationally educated nurses and really have put in a very robust program to ensure the success of those candidates when they come to Canada now. So we have, we're going at it from all different levels, and we'll continue to certainly consider options as we progress with suggestions from our community leaders and our educational leaders as well.
Matt, could I add a quick comment? We've done some work on this. So recently released report looking at retention of our graduate students in New Brunswick, including nurses, LPNs, and RNs. And we found that where you're from before you enroll matters a lot. So we're doing a much better job of keeping our New Brunswick trained nurses in the province if they're from New Brunswick. And if you're from other parts of Canada, your retention rates in New Brunswick are lower if you're international students. So having the data to be able to look at what the trends are and then understand at a system level what's causing people to stay or to move, I think is really vital for looking at solving the health human resource issues going forward.
Go ahead, Shelley.
I was just going to add quickly as well, in addition to Minister Shepherd, when you were speaking about how people are interested in having opportunities to go from LPN to RN and so on. I know other students too. Not everybody actually wants to change their role. They want to stay, say, as a registered nurse. And so I think for what I've heard from students as well, what they're interested in is having opportunities within their practice setting to advance. So whether that means, they want to have opportunities to advance within their role, that's helps retain them within their current setting. So also thinking about, when we think about recruitment and retention, just really think about what will help keep them here in New Brunswick. And there's lots of factors we can consider. It's having opportunities to advance in their career, having good mentorship roles, having a positive workplace, good work-life balance. Like we know all these things. So I think sometimes we talk a lot about recruitment and so on, and I think there's a lot of opportunity in the workplace to be looking at ways to really retain those that we have in our current workforce.
Thanks so much for that. Now we've got just a couple of minutes left, so I'm going to pose one question, and I'm going to combine a couple of them into a parting comment from each of you before we turn it over to our president to wrap things up. The question has been posed: what role do New Brunswickers have to play in building a sustainable, future-ready healthcare system? We've had a question about the role of sport and recreation, and about how can we all work together to break down silos, not just within government, but across communities. So I want to offer each of you a very short parting word on how folks viewing today can play a role in helping drive future sustainability for our healthcare system. And I think I'll go in reverse order as folks presented today. And so Eric, you'll get the first 15 to 20 seconds.
15, 20 seconds. So, I mean, I'll go back to the same point, which is to get engaged. So there's two ways to do it. You can think about how you get engaged in this process of innovation and evolution. And so there's lots of opportunity, as you've seen through the speakers today, to reach out and get involved in these things, whether it's part of research as a participant or informing the research. Long term, I think the answer is also to be engaged in your own health and understand that you have a role as part of that process as well. So again, there are opportunities growing to continue to do that earlier on in the process. And so I encourage everybody to reach out that way.
Thanks very much. Dr. Kelly Scott-Story.
Sure, Eric's hard to follow because I would say ditto. But in terms of engagement, I mean, I think the initiatives by Minister Shepherd in terms of welcoming the voices of the citizens has been really impactful and valuable. And I would encourage, that engagement. I believe that we're going to, or Matt, you mentioned putting up the email of putting ideas forward to the government. And, continue to be engaged. New Brunswick is an amazing province. We're the little province that could, and the energy, and to capitalize on this energy and this collaboration and this interdisciplinary, intersectoral type of approaches, I think is the key to success of healthcare reform in New Brunswick.
Kelly Doucet.
I think most has already been said, but I would say it's just to, when engaging, is to not do it in your silo. So not writing hundreds and hundreds of letters to, maybe if everyone could just kind of combine their efforts into making recommendations on how we can, inform this discussion of system change, if we could collectively try and come together to brainstorm, strategize, and see more collaboration and less silos in terms of transforming the future of our healthcare system would be where I would recommend.
Dr. McDonald, quick snippet. You're on mute, my friend.
First victim. We're about the size of Mississauga. We're small. We know each other. We don't have Ontario-sized egos. I think we just need to listen more to all the stakeholders, including our citizens.
Rowena Rosati, our friend from British Columbia.
Echoing what many said, I believe that you can be an inspiring Canadian leader model because of the integration and the collaboration and your ability to be nimble and cross over all of those silos. You become a microcosm of what every health authority across the rest of the country continues to be challenged with, because they're competing with multiple other health authorities. You actually can become a single united voice, and I think can really take this because of the impacts. You're so client and consumer informed, consumer being really, really important here, because that's also going to be a future driver, I think, in health and technology innovations. You can be a leader here. I want you to step into that and blow the doors off.
We're ready to lead, and Dr. Hauff, you're one of the leaders to take us away.
Yeah, I think you mentioned it. You said, how can every New Brunswicker be involved? Because every New Brunswicker has to be involved. We are all in this together. Every one of us can play a role. And if it's just a small conversation with someone in need, we can be part of it. And I have learned since I'm here in New Brunswick that the community and the value of community and caring about each other is one of our largest strengths. And we really have to build on this.
Thanks so much. And Minister Shepherd, final word to you.
Well, for sure, humanity matters. And when we put it at the center of our focus, it's always going to have a better impact. And I think that communities can play a very pivotal role when they look at their infrastructure and their recreational opportunities. We know that investing in upstream isn't going to pay off immediately. It's going to be an evolution, and we need to support it and we need to invest in it. I also want to say that I fully believe that New Brunswick can have a network of excellence when it comes to the delivery of healthcare services and health research. And I think that we have this opportunity, and I'm looking forward to it. I'm excited. I like the challenge. I want my time here to be meaningful.
Wonderful. Well, this has certainly been a meaningful conversation today. And like we say, we're hoping that some of these ideas will turn into action. And I want to thank you all. And with that, I want to turn it over to UNB President and Vice Chancellor, Dr. Paul Mazerow.
Thank you, Matt. It's been a terrific afternoon. And I think I speak for everybody. We could be here all day because this is such an important topic to engage with. So on behalf of UNB, I want to offer my sincere thanks to everyone who joined us today for this important conversation. I recognize how busy everyone's schedules are and appreciate the time that everyone's invested in joining us today. Sorry, I'll just put my video back on. So I know you're all busy, so thank you for joining us today and committing the time. We have a lot of capacity at UNB, I think you can see that, but we also have a lot of capability, and we're connected from around the world to other networks of experts. And in that sense, I think we're really well placed at the university to enable the essential conversations critical for the ongoing economic, social, and cultural health of our community. So we're really committed to doing that. Your participation today in the Shaping the Debate event has strengthened the contribution we can all make to the future of sustainable healthcare in New Brunswick. And this really is a major social challenges for us all, and that it will require some innovative ideas and approaches, a commitment to change, a commitment to confront barriers, and a willingness to persevere in the reform process. So I want to take a moment to thank all of our speakers for the time and their insights that they provided today. And as was said, we can lead, we can make a difference. I also want to offer a special thanks and acknowledgement to the Honorable Dorothy Shepherd, Minister of Health, who, as you know, is undertaking a very comprehensive reform process that is highly consultative. I should also say the theme of beyond 90% is something that will stick with me. What an important metaphor. We can't settle for 90%. We have to aim high, and we can. So this is time for all of us to take part in this important review and reform process. As the minister said, there's still time to send your thoughts and ideas into healthplansante@unb.ca by the 15th. So thank you all again. Thank you, Matt DeCourcy. Good afternoon and best wishes. That concludes the Shape the Debate event. And thanks for all your attendance. Bye-bye.
Where is the University of New Brunswick? It's anywhere our people are empowering their communities. It's wherever they're becoming catalysts for change and improving lives. It's where we help you find your future. Where is the University of New Brunswick? It's anywhere our people are harnessing the power of their creativity. It's wherever they're imagining new possibilities for a better world. It's where we help you find your future.